राजीवलोचन जय जय राम राजीवलोचन रघुकुलभूषण जय रघुराम जय रघुराम दशरथ नंदन लावण्य राम अभय प्रदायक आनंद राम जानकी वल्लभ सुगुणाभिराम जगदोद्धारा सत्य साई राम जगदोद्धारा सत्य साई राम राजीवलोचन जय जय राम
Offering our salutations at the feet of Sadguru, respected elders, esteemed guests, doctors and luminaries in the healthcare sector, students and staff, brothers and sisters, Sai Ram and good evening. Welcome to the valedictory session of the Global Conference on Post-Pandemic Reforms in Medical Education for Accessible and Affordable Rural Healthcare. We begin by extending our welcome to the guests seated on the dais. Our chief guest, Dr. K. Sudhakar, Honorable Minister for Health and Medical Education, Government of Karnataka. Professor Dr. M. Maudgalya, Professor of Chemical Engineering, Indian Institute of Technology, Bombay. Dr. A.G. Pradap, Registrar Academics, Professor and Head of Department of Microbiology, M.S. Ramaya Medical College, Bangalore. Dr. Snehal Kulkarni, Director of Pediatric Cardiology, Sri Sathya Sai Sanjeevani Center for Child Heart Care, Nava Raipur, India. Joining us virtually from the US is Dr. K.S. Anand, Senior Pediatrician from Stanford School of Medicine, who has been a pillar of support leading the organizing committee of the conference. From the leadership team of Sri Sathya Sai University for Human Excellence, we have Shri B.N. Narsamurthy, Chancellor. Dr. Srikantamurthy, Vice Chancellor. Sadguru Sri Madhusudan Sai, revered founder and the guiding light behind this conference. We will commence with invocation by the university boy students chanting the Sannyasa Suktam.
गणपतिगुं हवामहे कविं कवीनामुपमश्रवस्तमम् ज्येष्ठराजं ब्रह्मणस्पत नः शृण्वन्नोतिभिः सीदसादनम् प्रणो देवी सरस्वती वाजेभिर्वाजिनीवती धीनामवित्रयवतु गणेशाय नमः सरस्वत्यै नमः श्रीगुरुभ्यो नमः हरिः ओम् नकर कर्मणा न प्रजया धनेन त्यागेनैके अमृतत्वमानशुः परेण नाकन्निहितं गुहायां विभ्राजते तद्यतयो विशन्ति वेदान्तविज्ञानसुनिश्चितार्था सन्न्यासयोगाद्यतयः शुद्धसत्त्वाः ते ब्रह्मलोके तु परान्तकाले परामृतात् परिमुच्यन्ति सर्वे दह्रं विपापं परमेश्वभूतं यत्पुण्डरीकं पुरमध्यः सघ्रस्थम् तत्रापि दह्रं गगनं विशोकस्तस्मिन् यदन्तस्तदुपासितव्यम् यो वेदादौ स्वरः प्रोक्तो वेदान्ते च प्रतिष्ठितः तस्य प्रकृतिलीनस्य यः परः स महेश्वरः ॐ शान्तिः 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 हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु।
Over the 2 days, we have heard from leading experts ideas and thoughts, strategies and solutions to the existing challenges in the field of medical education. And it was unanimously agreed upon that it is time for reforms in format, curriculum, structure, funding, evaluation, and access to quality medical education to be framed as policies and, more importantly, implemented in action. The cheaper and easier it is to get medical education, the more accessible and affordable will be healthcare to the masses. As our founder remarked yesterday in his inaugural message, that our mission and goal is healthcare to the rural, by the rural, that is training inspired healthcare professionals from rural areas and for the rural communities. We will now have a summary of this morning's proceedings presented by Brother Yuvasupreet Reddy. He joined our institution in his grade 6 and is currently pursuing his first year medicine at the Subbaiah Institute of Medical Sciences, Shimoga. Brother Yuvasupreet.
Sairam, good evening to one and all. Today, I'm here to read the summary of the 2 technical sessions 3 and 4 of the International Conference on the Post-Pandemic Reforms in Medical Education for Accessible and Affordable Rural Healthcare, which were held this morning. The first technical session on the topic, Acceptability of Medical Education, began with a video presentation by Dr. Mimi Guarneri, Founding President, Academy of Integrative Health and Medicine, San Diego, California, who spoke on the topic of enhancing the acceptability of integrative medical education, telemedicine, and artificial intelligence. Despite various technological advances, the world still suffers from a burden of preventable diseases, and a new model of education and healthcare is the way forward to help clinicians go beyond their primary area of specialization. The second speaker, Dr. Rajagopala S., Associate Professor and the Head of Department, Kaumara Britya, Pediatrics, All India Institute of Ayurveda, spoke on the topic of academic experience on the integration of Ayurveda and modern medicine at the All India Institute of Ayurveda. He stressed the need for integrative medicine and charted a plan to integrate this at various levels, including knowledge, practice, and research and development. Endorsing a holistic approach in treatment, he concluded by saying that integrative medicine is the future. The third speaker, Professor Dr. Kannan M. Maudikalya, Iraq and Mehru Mehta Advanced Education Technology Chair Professor, Indian Institute of Technology, Mumbai, spoke on the topic enhancing the acceptability of integrative medical education, telemedicine, and artificial intelligence. He emphasized the importance of producing quality audio and video presentations in order to make online learning more effective as well as resourceful. The fourth speaker, Dr. Vasudeva Upadhyaya KS, Head of Department of Anesthesiology, Sri Sathya Sai Sara Memorial Hospital, spoke about incorporating integrated medicine into general practice and current medical curriculum, its challenges and solutions. Speaking about a biased mindset towards Western allopathy, he proposed shifting towards an integrated medicine approach and concluded that real integration is the Indian way towards successful medical practice. The fifth speaker, Dr. Hira Malini Sheshadri, a senior rheumatologist at Sri Sathya Sai Sarala Memorial Hospital, shared her thoughts on the topic, the need to promote respect for the traditional Indian system of medicine in the medical curriculum, historical aspects, and the current research on the value added by these systems. She revealed the many holistic practices and methods of Siddha medicine which have been adopted centuries later by both Western and other medical traditions. She concluded by urging Indian medical students to take pride in Indian medical heritage and accord it due respect. The dignitaries and the chairs summarized the session with the message, all medical traditions should work cohesively, complementing each other instead of contradicting, and that medical education and healthcare should be provided free of all cost, just as it used to be in the ancient times. The sessions closed with a felicitation of the panelists by the session chairs, Dr. Jorge Bera and Hira Malini Sheshadri. Post-break, the second technical session on the quality of medical education was chaired by Dr. Bharat Ramesh Konan, General Surgeon, and Dr. Arvind Akshan, a Senior Pediatrician, both from Sri Sathya Sai Sarala Memorial Hospital. The first speaker was Professor Dr. Krishna Kumar, Professor and Head of Pediatric Cardiology Department, Amrita Institute of Medical Sciences and Research Center. He joined us online to speak about career development for faculty who serve as inspiring role model for educators for medical students. Sharing his deep passion about teaching, he pointed out that a good mentor should have a strong spirit for learning and be committed to this lifelong development of the student. He drew clear parallels between such mentors and the gurus of the ancient Gurukula system. The second speaker was Kawaljeet S. Anand, Professor of Pediatrics, Stanford University School of Medicine, Palo Alto, California. He examined the topic, a comparison of external credentialing versus internal audits for quality improvement. He discussed many methods for quality improvements, such as Plan, Do, Study, Act, the PDSE cycles, adopting Six Sigma principles, and others. He proposed an interdisciplinary, evidence, and system-based approach to ensuring quality. The third speaker, Dr. A.G. Pratap, Registrar, Academics, Professor, and Head of Department of Microbiology, M.S. Ramaya Medical College, Bengaluru, shared his ideas on the topic, how to evaluate the social impact, human values, working environment, and student integral health in medical colleges and teaching hospitals. He suggested adopting student-centric faculty exchange programs, practicing biomedical ethics, promoting inclusiveness, and innovative teaching learning process as some ways to evaluate metrics listed in this topic. The fourth and final speaker, Dr. Snehal Kulkarni, Director of Pediatric Cardiology, Sri Sathya Sai Sanjeevani Center for Child Heart Care, Kharghar, Navi Mumbai, discussed the topic, stakeholder feedback methods and their implementation to improve institutional quality and trust. She identified the key stakeholders as medical students and the patients, and shared that feedback, effective communication, and implementation can go a long way in improving an institution quality and overall trust. The session's co-chair, Dr. Bharat, summarized the panel discussions. Thereafter, Dr. Srikanta Murthy, Vice Chancellor of Sri Sathya Sai University for Human Excellence, delivered his closing remarks and felicitated the panelists, thereby concluding the technical sessions of the two-day international conference on the post-pandemic reforms in medical education for accessible and affordable rural healthcare. Thank you, Sairam.
We now request our chief guest, Dr. K. Sudhakar ji, to kindly address us.
ಓಂ ಸಾಯಿರಾಮ್. ಮೊದಲನೇದಾಗಿ ಸದ್ಗುರು ಶ್ರೀ ಮಧುಸೂದನ್ ಸಾಯಿರವರ ಪಾದಕಮಲಗಳಿಗೆ ಅತ್ಯಂತ ಶ್ರದ್ಧಾಪೂರ್ವಕವಾದಂಥ ನನ್ನ ನಮನಗಳನ್ನು ಅರ್ಪಿಸ್ತಾ, ಅದೇ ರೀತಿ ನಮ್ಮ ಹಿರಿಯರು ಈ ಸಂಸ್ಥೆಯನ್ನು ವಿಶ್ವಕ್ಕೆ ಪರಿಚಯ, ವಿಶ್ವ ಮಟ್ಟಕ್ಕೆ ಎತ್ತರಕ್ಕೆ ತೆಗೆದುಕೊಂಡು ಹೋಗ್ತಾ ಇರೋದರಲ್ಲಿ ಸ್ವಾಮೀಜಿರವರ ಹೆಗಲಿಗೆ ಹೆಗಲು ಕೊಟ್ಟು ಕೆಲಸ ಮಾಡ್ತಾ ಇರ್ತಕ್ಕಂಥ ನರಸಿಂಹಮೂರ್ತಣ್ಣವರು ಮತ್ತು ವೇದಿಕೆ ಮೇಲೆ ಉಪಸ್ಥಿತರಿರುವ ಎಲ್ಲ ಗಣ್ಯಾತಿ ಗಣ್ಯರೇ, ದೇಶ ವಿದೇಶಗಳಿಂದ ಬಂದಿರತಕ್ಕಂಥ ಎಲ್ಲ ಸಹೋದರ ಸಹೋದರಿಯರೇ, since I was told that there are participants from over 22 countries, so I would like to say my few words in English so that for the benefit of everybody's understanding, and all my dear students, friends from the press and media. The subject of International Conference on Availability, Accessibility, Affordability of Medical Education and providing the good infrastructure of healthcare services, service deliveries in rural area. This is the topic which is very close to my heart. I am also a medical graduate, but I did not become a medical graduate so easily. So, to begin with, I would like to share my story. I have shared few times, but the audience being new audience, I think I'll repeat my story. I'm a son of a small farmer and a school teacher who is a school teacher. After I finished my 12th standard, I had a passion of becoming a doctor. Those days we had only two professions that we knew. One is doctors and another one is engineers. So we didn't know the third. Those who don't get medicine and engineering, they would go to arts and other studies. So as soon as I completed my 12th standard, though I paid for my competitive exams, then I could not get through. And that time the management fees was high. I still remember it was about 3 lakh or so, which we could not afford. Today's the scenario is different. Some students, some parents come up to me and they say now, even for a graduation, that is MBBS, it costs more than 80 lakhs, 1 crore, and some institution costs, in some institutions, 1.2 crores, those who do not get the government seats. So 1 year I had to stay back at home without going to pursue because I was so bent upon studying medical education only. So then my dad decided to sell 1 acre of the grape land that we had. He had to sell that 1 acre and admitted me, got me the admission for medical graduation in Tumkur, Siddhartha Institute of Medical Sciences. Why I say that? Today the scenario is not different from what I witnessed about 26, 27 years ago. But the medical education has been a very, very important platforms or the backbone of this country to provide the secondary and tertiary health care. Our Honorable Prime Minister, I should acknowledge and congratulate to have understood this issue. When he became the Prime Minister, from 2014 till date, he has added at least more than 200 medical colleges in the country today. The government medical colleges I am talking about. Today, the annual admissions for medical graduation is close to 1 lakh in a year, the entire country, 1 lakh students. How many students appear for the competitive exams to get into medical education? 1.5 million students. That is 15 lakh. Out of which, about 40,000 students will get the government seats, where the fees are completely, very low, subsidized by the government, and it is in the government institutions. So only 40,000 get, and the remaining 60,000 are available in the private institutions. And these courses that are available in the private sector, it is exorbitantly very high. None of the students from the middle class or the lower middle class can even dream of studying medical education today. Apart from this 1 lakh students that get entry into the medical college system, apart from that, another 20 to 30,000 students, Indian students, go abroad. China, Russia, Ukraine. These are the countries they go, because they feel that the fees are less compared to that is available in India. If you have observed in Ukraine, during this war, more than 600 students from Karnataka alone, they came back. I've had extensive one round of meeting with them. We are studying the modalities, methods of how we can help. Because we have a NMC, which is the governing and regulatory body in the government at the center, who regulates the entire medical education in India. So, the post-graduation seats were also increased by 78% by our Honorable Prime Minister. He came up with an idea that there should be one medical college in every district across the country. So each district, we all know that it can cater, or the population in a district would be between 10 lakhs to 20 lakh population. So even in our Karnataka state, we got 4 medical colleges during my tenure. One, I am very happy to say that in my own district, Chikbalapur, the same district that you are all present today, it's almost ready now for inauguration, maybe in January. I will request our Honorable Swamiji also to be part of that inauguration that time. So, apart from Chikbalapur, we started Chikmagalur, we started in Haveri and Yadgir, which is in North Karnataka, aspirational district. Why I was very much interested to start medical college is also, there is a small personal story. Since I was living in a village nearby Chikbalapur, which is about 20 minutes to Chikbalapur town, but 1 hour to Bangalore. We didn't have a good secondary and tertiary hospitals in Chikbalapur then. I'm talking about 2005, October 29th, where my mom had, massive myocardial infarction, heart attack. So we didn't have time, nor we had logistics support to shift her to the nearest tertiary health center. So we could not save her. So that day I decided, somehow Chikbalapur should get. I didn't imagine then I can get a medical college myself. But I always thought that there should be a good hospital in Chikbalapur. But destiny is such that I myself became the medical education minister. Today I am sanctioning medical colleges. So, always divinity decides our course of journey. Coming back to medical education, the role of medical education in creating the good health infrastructure, good health care service delivery. We all know that medical colleges to establish is a huge investment. It is like, many people say jokingly, it is like feeding a white elephant. Because the investment is so huge. I have seen medical colleges, at least I know how medical colleges are established in US, in West Indies, in so many islands nearby US. They would start off in one building of about, say, 30,000 square feet, 40,000 square feet, without much capital. But on an average, in India, if you wanted to start all these years, you had to shell out a woofing 500 to 600 crores of money, seed money, to start a medical college. So it is such a high capital investment for any private establishment to start. So you need deep pockets. And how do they pay their EMIs if they have taken the funding from the banks? They have to charge it on the students, they have to charge it on the patients that come for their hospitals. That is why, though it is available, though it is accessible, I say that today the healthcare is not as affordable as it should have been. The medical education also, it is not as affordable as it should have been. So our Swamiji, our Sadguru has understood this. So last year he decided, I want to start a medical college for only poor people, just like how government can provide a free education. He wants to give the seats, medical education, to the poor people, poor students, bright students, the committed students who come back and who serve the society in rural areas. This is the real, this is the very good initiation that our Sadguru has taken. And we very, very happily last year, along with our Chief Minister, our Home Minister of the country, we came and did Bhumi Puja for the hospital and medical college. So I am all the more happy because I thought to start off only one good hospital in Chikbalapur, but we are blessed by Almighty. In Chikbalapur, we are going to have 2 medical colleges and 2 super speciality hospitals for the people of Chikbalapur. So as a medical education minister, I began in 2000 February, where after I assumed the charge, in less than a month, we encountered what was not understood, what was not in the planning, the pandemic. We encountered such a huge pandemic which we were all taken by surprise, huge surprise. And what was not witnessed in the last 100 years. Neither the health systems, nor the doctors, nor the government were aware of how this pandemic would turn out to be. And that was the scenario, that was the situation when I became a medical education minister. And our Honorable Chief Minister then, in less than 2 months after going into the COVID, he had another responsibility of a huge health and family portfolio as well. So after a span of 30 years, he gave me an opportunity to serve both health and family welfare and medical education, both the portfolios, and serve the state during the most difficult times of the pandemic. So I thought it is an opportunity and it was a huge challenge for me. With Sadguru and Almighty's blessings, Karnataka, after the second wave, we were judged as the best combating state to handle the pandemic, to mitigate the pandemic in the entire country. We were awarded. This could be achieved only with the support, with the cooperation, with the relentless effort of the entire healthcare department, be it doctors, our healthcare staff, nursing staff, ASHA Karyakartas, D group workers. Every person had their role to play. And within that 2 years, I was telling Sadguru, what we created during COVID was unimaginable. What could not be done in the last 50 years, we could achieve in the next 2 years during COVID. We prepared our hospitals. Just to give you some example of what we did to the infrastructure. We had close to 7,000 or 8,000 beds which were with oxygenated beds, which had oxygenated lines. In a matter of 1 year, from 7,000-8,000, 35,000 beds were linked with oxygenated pipelines. So this is what Karnataka did. And even the ICU, we ramped up the ICU beds to almost 3 times. And the appointments of doctors, we hired and recruited more than 4,000 doctors in rural areas and in urban area. Today you will not find even one primary health center, which is our structural and functional unit of the primary health services that we have as a model in Karnataka. You wouldn't find a PHC without a doctor today. So that is a remarkable change. Thanks to COVID, we used the adverse situation, and we turned into an opportunity. We never ducked during crisis. We were always positive. We were brave. We were trying to understand by talking to all the countries, many health institutions around the world, and understand where this pandemic is going, how best the healthcare can be provided to our people to save more and more number of people in Karnataka and India. thanks to the decisive leadership of our Honorable Prime Minister, time to time he used to suggest us, time to time he used to motivate all the states. Though there is a federal structure in this country, we have different political parties who are ruling in different states. But as a statesman, our Honorable Prime Minister ensured there is one command for one nation, one same treatment for all 130 crore people. And what vaccination did to us. Yesterday is a great day of joy where we celebrated of administering 200 crore vaccine doses yesterday in a record time of 18 months. Even the most developed countries, they have not been successful in administering even the 40% or 50% of the population. But we have successfully vaccinated more than 90% of the population. Initially when COVID broke out, because of our density in population, because of the status that we are, our status is that we are like a developing nation. So many people thought there could be deaths everywhere. We could witness the deaths and we can see the dead bodies in roads, in bus stops, near the hospitals. This was the kind of thinking that many people really thought about. But fortunately, with a very aggressive leadership, political leadership, our health systems, our doctors, our all state departments, they worked closely, worked relentlessly, day and night, to ensure that pandemic is mitigated, pandemic will be defeated, and we saved lakhs and lakhs and lakhs of people today. And today, I don't see any of you, at least 90% of you, without masks. So that is the level of confidence today Indians have, because you are all aware that you have been fully vaccinated. And now we have started the third dose of vaccine, preventive dose also. 75 days, we will be targeting 4.2 crores in Karnataka alone, which is the adult population that we have from 18 years to 59. We'll be administering this 4.2 crore doses within 75 days. This is the target. So coming back to the medical education, it is not just the quantity of medical colleges, the number of medical colleges that is paramount. It is the quality of medical education. What do you mean by quality of medical education? See, the emphasis should be on clinical practice, good clinical practice. Similarly, you should have lay an emphasis on research and development. Any medical college should inspire their students, motivate the students to get into the research area. Where we are still lacking, let us agree, let us accept the handful of medical institutions that are there in this country. Not many medical colleges have concentrated on improving or motivating their students, encouraging their students in research area. They need to publish international material. They need to have a tie-up with the most advanced universities across the country. In fact, today I have requested our Vice Chancellor Rajiv Gandhi Health University. It is the only health university that we have in Karnataka. I have requested that this university should get a tie-up with all leading universities, medical universities across the globe. And also there should be an exchange program between students and faculty. We have seen today the Oxford University from Britain. They were the ones who came out with the vaccine along with AstraZeneca. So that is what we initially did it. After that, the homegrown vaccine, which is Covaxin from Bharat Biotech, we were the ones, we also came out with the vaccine along with UK, that is the Oxford University's vaccine, Moderna from US, mRNA, and yesterday we have got the clearance for dRNA, the first dRNA vaccine of Indian grown. This is new India. This is the new vibrant India that we have today. So research in any medical college should be really encouraged. That is my take. Secondly, the modern technology, use of the modern technology, use of modern tools, learning tools that we have. This is where our students can get more access to information. Because today, innovation is the order of the day. Today, the medical practice or the healthcare wouldn't move an inch without the engineering innovations. Today, we are seeing robotics, the role of robotics, the role of artificial intelligence, the role of CT scans, X-ray machines, mammographies. Everything is technology. If you want to diagnose anything, you need technology in place. So engineering and medical sciences go hand in hand. So artificial intelligence and logarithms is taking one step higher and forward. We were always talking about preventive medicine, but today we are talking about predictive medicine. So we can predict what exactly can happen to an individual in 2 years or in 5 years based on data algorithms. So there are some countries using their data, they can predict these kind of informations, like Israel, like US. Similarly, India will also try to implement these. Karnataka state is a welfare state, and it is a pioneer state in medical education. We have the highest number of medical colleges in the entire country. Today, we have close to 1.5 lakh students who study every day, every year in medical education. Medical education is not just medical degrees. You need associated nursing education, allied sciences, paramedical courses. You need a quality education in these areas also. Without their support, only doctors can't do anything. In the entire world today, there is a huge demand for good nursing care, good nurses, especially Indian nurses are in high demand. So, if you need to produce good nurses, you need to have a very good nursing education. Similarly, allied sciences. We have also Ayush education today, which is the traditional medicine. Traditional medicine is as old as our Vedas, right? From Ayurveda, Unani, Siddha, yogic sciences. These are very, very old. And today there are many colleges which are mushrooming in this state. And I'm so happy that people are believing in traditional medicine. Not just the students, and also the people of this country. They are going back and they are believing their system of traditional medicine. But only my piece of caution to them is, they should document it. With research, they should document it, they should publish it, because every belief, because you just can't believe a medicine unless there is a proper research, proper publication, proper documentation. And there should be a standardization. So the traditional medicine also, to promote the traditional medicine, Karnataka, last year itself, I proposed a bill to establish a new Ayush Autonomous University in Shivamogga, Karnataka. Just last year, last session, the legislation was passed, and we'll be establishing the Ayush University also. So I am very happy today, Swamiji, today he has selected the right subject, because this is the timely subject. Today, post-pandemic scenario, nobody knew couple of years ago that we will come out of pandemic so quickly, because we had lockdowns, work from home culture, lot of our companies were shut, lot of our businesses were shut. It was really disheartening to see people who were street vendors, vegetable vendors, the working class really suffered a great deal. But thanks to the advancement of the health sciences through vaccines, today we have considerably beaten this COVID pandemic. So the medical education, the healthcare go hand in hand. We want to develop the best primary, secondary and tertiary healthcare across Karnataka. And today we are talking in certain disciplines, even the quaternary healthcare services also, like in mother and child, because we want to bring down the infant mortality rate. We want to bring down the mother's maternal mortality rate, MMR and IMR. Should be, the number should come down to what WHO has given us the target. We have to meet those targets. That is why I said it is not just how many colleges, how many hospitals we have and how many doctors we have. We had one doctor for every 1,700 or 2,000 people way back 2 decades back, about 20 years ago. But today, as WHO wanted 1 doctor to 1,000 population, today we have surpassed that target and we have 1 doctor to 700 people in Karnataka. That is the achievement. So, as there is availability, as there can be accessibility, affordability should be the immediate target of all of us and the state governments. We should all properly plan things. We should come together. Always Swami says, government and organizations like Sathya Sai, which is a selfless institution, and some private sector, we should all come together. It has to be a partnership between the people and the government. For any venture, for any progressive outcome, we have to come together, and that is the way forward. I look forward for greater participation of the like-minded people to progress in medical education, to progress in healthcare, so that the last person, the last mile of this state and this nation is connected through a quality healthcare services, which is his right. In my opinion, right to health is a fundamental right of a human being, human values, human rights. So this fundamental right should be given to the common man. As our Honorable Prime Minister always says, Sabka Saath, Sabka Vikas, Sabka Vishwas, Sabka Prayas. So with all our efforts, let us strive hard to make this nation greater and greater. Thank you for the opportunity. Namaste. Jai Shri.
Thank you, sir, for joining us this evening and sharing your thoughts with all of us. We would like to extend a token of our appreciation to Dr. K. Sudhakarji. On behalf of all of us, we pray to Sadguru for his valedictory message.
In our scriptures it is said, Dharmartha Kama Mokshartham Arogyam Moolam Uttamam. In order to attain the four goals of human life, which we all know: dharma, the righteous living; artha, righteous earning; kama, righteous desires; and moksha, ultimately liberation. All these cannot be achieved unless we have good health. Health is the fundamental need to even achieve these four goals of life. This rule is applicable to individuals, to institutions, and even to a nation. A nation which is healthy alone can be wealthy. People can work morally, ethically, lawfully, earn wealth, fulfill right kind of desires. There won't be strife, there won't be conflict, there won't be crime. And ultimately the nation becomes independent of evils like poverty, deprivation, marginalization, and such social evils. So that is the moksha for the country too. So unless a nation is healthy, it cannot achieve any of its goals. Therefore, healthcare in the present times and all times to come remains a very fundamental need, and as Dr. Sudhakar very rightly said, it is the fundamental right of every individual. And it is the responsibility of the society, the institutions like this, and the government to work together in order to make this right available to every person. Governments alone cannot achieve it. We are a huge country, very populous. We are going to surpass our neighbor China in a year. Every day 75,000-80,000 children are born, and most of them are born in rural areas. Therefore, government alone cannot do everything, even if they try their best. There is a handicap there because of the size of the nation, geography, as well as the population. So other sectors have to pitch in order to make healthcare affordable, accessible, available, as is the topic of this particular conference. I'm very glad that this conference has had such wonderful participants, speakers, and it has forged a new way, very unique way to provide healthcare to the rural masses by reforming the healthcare education itself to begin with, which is the key, which is the fundamental, because healthcare delivery is not about having hospitals and equipment, it's about personnel. It's about doctors, nurses, paramedics who should be trained well clinically as well as they are good humans, compassionate. That's not available in most of the places. If they are very capable, they are not very nice to people, they are very profit oriented. And therefore, the entire idea of healthcare in a holistic way is not delivered to the patient, and the sufferer is the patient. So a lot of good ideas, and though I was not physically here, Dr. Madhusudan, I was watching it on the YouTube. Your talk, Pratapji, your talk, and our Dr. Snehalji's talk, as well as the talk by other eminent people who are here, and those who were there in the morning and yesterday. I was listening to all the talks. And I was very glad that everybody was thinking in the same lines. Everybody felt that yes, this is the need of the hour. Healthcare has to be made accessible, affordable, available to everybody who wants it. And there are many ways of doing it. It could be an integrated approach to healthcare. It could be approach as from the IIT Bombay, as the professor is saying, that we must take technology to the doorsteps of, use technology to reach out and bridge the gaps. A wonderful initiative. I was so surprised and very pleased to see the kind of work they have done. 7 million viewers of the material that they have produced through IIT Mumbai. It's a wonderful job, and I'm sure that will remain there forever for anybody to access it. So, and we are looking at signing an MOU. Dr. Sudhakar just now said, we must work together in this field of research and innovation. So, we as a hospital here are signing an MOU with IIT Mumbai to develop a methodology, a research methodology for mother and child healthcare. Again, a great pillar, as you mentioned, the fourth dimension of healthcare is now to take the healthcare to mother and child care. Prevention, preventive and the predictive healthcare is the way. Precision healthcare is the way. And as a group, we are very glad to let you know, Dr. Sudhakar, that we are establishing 10 mother and child centers. 7 of them are already underway, and 3 more will be done by the end of this year across the country. That will be a collective 500-bed facility, 50 bed per hospital, which has an OT, which has a delivery ward, which has got an ICU, it has got fetal medicine. So you name it, from Rishikesh to Jamshedpur, Palwal, Haryana, Chhattisgarh, Maharashtra, that is in Mumbai, as well as Yavatmal, Telangana, Karnataka here in Chikbalapur. And all these places are being covered through Mother and Child Initiative. And in Karnataka especially, we work very hard on the mother and child care. And we have a lot of our feet on the street kind of healthcare delivery professionals, and all ably led by the team from Sarla Memorial and the guidance of Dr. Satish Babu. They go out to the villages, they identify the problem, they try to bring the patients to the hospital, get them checked up regularly, and make sure that if there is a complication, then there is an institutional delivery with the best quality that we can provide. Just the other day I was saying how this mother and child center inside Sarla Memorial Hospital is benefiting people. Daily we have 3 deliveries or so, and out of which many are premature, preterm deliveries. And one day when we went there, there was a 32-week baby in the NICU. And imagine you were talking about Chikbalapur having high-end, high-quality healthcare, especially pediatric. And this is a hospital which has the NICU facility where even a preterm baby, 32-week, can be taken care of. We had several such cases where we have kept them throughout in our NICUs, PICUs, looked after them for 40, 50 days till they came out of the woods and they were healthy and they went back home. So many of these wonderful things are happening because the wonderful team of doctors and healthcare professionals who are available in this hospital and in all our hospitals, they are so committed. They are the role models for the future generation of doctors, nurses and paramedics. Dr. Sudhakar has been associated with our healthcare mission, especially here, right from the day one. He did the Bhumi Puja of the Sarla Memorial Hospital way back in 2017. Recently, when we upgraded the hospital with oxygenated beds, and he came again, brought the Chief Minister, made him understand the work that we are doing. And today, within 6 months, thus the data of 6 months says around 80,000 patients have been treated, 2,500 surgeries have been performed in this very facility. And all for free, absolutely no charges to anyone. That is the India that we dream of, the India of the yore, where healthcare was free. That's why Vaidyo Narayana Harihi. Because doctor was like God doing selfless work without charging anybody anything. Whatever people gave out of Shraddha was enough for the doctor. Teachers were gods because they taught without expecting any returns. Now if healthcare education has to come together, two gods have to come together, the teaching and the doctor. Right? So we have that kind of a system coming up, and Dr. Sudhakar is aware. It was his dream that in Chikbalapur we should have a super specialty hospital as well as a medical college. He, as a boy from the same district who grew up, struggled his way to get a medical education, and now with his hard work and the vision, just now he shared the understanding of the vision of the healthcare in Karnataka. It was so impressive, it was so comprehensive, so clear. It was so well articulated also. I'm very, I would say Karnataka is blessed to have a health minister who thinks like this, especially health and education minister both. We need such visionaries. And he's not only visionary, he's a man of action also. I've seen him work through the COVID pandemic, and I've seen how quickly Karnataka rose to its feet and did everything possible in its might. And there's no surprise that it bagged the award for managing the pandemic in the best way in the entire country. And today we are all seated in this hall conducting such programs. It's possible because of the hard work, right from the government to the last person on the street, the D group workers, who worked very hard through the pandemic. Oh, this is our country. Sarve bhavantu sukhina. Let everybody be happy. Sarve santu niramaya. Let all be healthy. That is the vision. And in few months from now, and Dr. Sudhakar is very much aware, he was there when Bhumi Puja for the new big hospital, 400 beds is being done. But I do not want to wait for that whole hospital to be ready. I want to start the medical college with the existing facilities, which he has very kindly, he told me that I will take the bill to the parliament. It will be my privilege to take this bill. And soon the other Rajeshwari Memorial Academic Block is getting ready, and it's a huge facility. Approximately, I am pushing them to finish it as early as possible, probably in October or November. And October is the date that we are looking at. And that will become perhaps the first hospital, teaching hospital, come medical college in the world, which will provide the facilities entirely free, both the clinical treatment as well as the education. Both will be free, not one and the other. This is our prayas, as he said, sabka prayas. This is our effort to make this vision of healthcare available, accessible, affordable happen in our country. Definitely, our country has progressed a lot in the last 2 decades. Everything has improved. Infant mortality rate has improved, MMR has improved. But to me, again, even if it's a mortality rate is even 20 or 25, every one of that is a child of some mother who died. And every mother is the mother of some child who died. To us, it may be statistics, may look good on paper, but to that family, that's a loss of life. That's so many emotions. That's so much of pain. So nobody should die. That survey, our country's motto is survey. Everybody should be healthy. Let us work towards that great vision of our ancestors. And that is the idea. And look at the wonderful the effort that is being put. We have people from so many countries. And I'm sure Karnataka government is working getting investments into Karnataka in various sectors, IT sector, manufacturing. I often read the newspaper and see how many efforts they're putting, and I keep telling our people, whomever I meet from Karnataka ministry, that Karnataka is poised for a great big growth in this decade. This decade belongs to Karnataka. It will do well in every sphere: economic, industry, education, healthcare, social sectors. Under their leadership, it will do very well. It will become one of the star performance as a state in the whole of the country. That is given. And also good work, hard work, leadership is good. I'm sure this will be achieved. I only look at the other side of the segment. The nicer part is that economy, industry, manufacturing, services, employment. But the rural side of the Karnataka also needs a lot of attention, which now they have started working towards it. As I said, for many decades it did not happen. Now it's happening. And in times to come, when the medical college is ready here, I'm sure like Ganga Yamuna, Chikbalapur Medical College and our medical college will serve the entire humanity, not just Karnataka, but the whole world. Let it come and benefit from the services of these hospitals. Having said that, there is definitely going to be a lot of emphasis on research and some way of integrating our traditional medicine systems be it Ayurveda, be it Unani, be it Siddha, in a very scientific and evidence-based way, as he's been advising, and that is the right way to do things. And healthcare is a science, and science should be dealt like science. Therefore, a lot of emphasis will be on the research. We have Dr. Sani from the Stanford, who virtually has joined us. We're working also on a simulation lab, a virtual reality lab, where children can learn without actually having to cut, dead bodies. They can learn through simulation, and they will be getting hands-on experience, like real life. These are some of those advancements in even teaching methodologies in the sphere of healthcare, which we will definitely incorporate into this particular college. And I was telling Narasimhamurthy ji a few days back, I think we'll have to request our government to upgrade the local railway station soon, because the patients will come here from around the country. And they will be, all Nandi station will become not for the Nandi temple so much, but because of the hospital where people get free services, they will come train loads of people. We have that will happen, that has to happen, because the crowd will be so much. And we must make it easy for them, accessible, you said, accessibility. If they come even to the nearest station, either on Andhra side or Karnataka side, they should be able to access this hospital, because it's going to be a 500-bedded facility to begin with. The first phase is 500 beds. Already we have 300 odd beds, but it will grow to 500 beds. And from there, it will further go to a 1,000-bed hospital eventually. So we will need a lot of logistics for people to come. And the best example I can give you, if you want to imagine what it's going to be like, is CMC Vellore. How that place is so crowded. Every day there is thousands of outpatients, so many surgeries. It's one of the largest facilities in South India, which gives subsidized and almost no cost kind of a healthcare facility. And I've been to CMC Vellore, I've seen patients coming from everywhere, from the northeast states also. People come in trains, traveling 3-4 days to reach CMC Vellore. And this was the vision of one single lady, Ida Skada. And the property that Ida Skada stayed in Kodaikanal, it now is a part of our trust. It is ashram there. So whenever I go there, I get very inspired, because that is that girl who stayed in that little property on the hilltop in Kodaikanal and decided to change the healthcare delivery in India, especially in the rural India. And she went to US, studied medicine in those days. I'm talking about 1930s and 40s. And came back to India, started CMC Vellore. It started in a bullock cart. She started in a bullock cart and that was a dispensary where she trained 3-4 rural young girls to help her, assist her in dispensing medicines. And she worked through the plague pandemic, through several such calamities that India faced tirelessly. And with that one single lady's zeal, today CMC Vellore stands as one of the premier institutions, both in terms of services as well as academic work. And I'm sure the only thing that can better it is if it's completely free, and which is what we can do. So you can imagine we'll have people coming from around the country and even from different parts of the world, like our Sanjeevani hospitals. We see patients from around the world, and they come because it is free. The travel expense is not as much for them as is the expense for the treatment in their own countries. So today we treat patients from almost all states of the country, all union territories, as well as from abroad. From many developing countries, patients come, Bangladesh, Pakistan, Afghanistan, even Middle Eastern countries, Syria. We had people coming from Libya, and such kind of far-off countries were very difficult for them to even travel and come. But they come and they get treatment absolutely free of cost. They become well, they go back. This is Vasudhaiva Kutumbakam. See, India never differentiated. These people are ours. They are our community, our caste, our religion, our nationality. That these differences never are there in India. We accepted everybody as our own. And anybody who needed help, we stretched our hands to help such a person. But this culture has to go into the psychology of every medical student, that I am here to serve. As I said, healthcare is a service, it's not a product. And one must treat it as service. And the good part is that Dr. Sudhakar just now mentioned, we must have allied sciences, we should have nursing, because without that we cannot run the hospital. So under our university, we already have got permission for the nursing college, paramedicals, 4 different courses in paramedics, and we have applied for our DNB program also. And I'm sure next year we will have the MBBS program as also coming here. So it's like one-stop shop for all your medical requirements. You can become doctor, you can become a nurse, you can become paramedic, or any other technician, or even a scientist, a medical scientist. We work with HD Medical Group from the US, which has a heart a machine. They have developed a stethoscope which has got, which can do an ECG. And you can carry it, it's a mobile thing, and you can see the results instantly on a tab. And that is connected on the cloud, so it can, cloud means not these clouds, the internet cloud. And the data can be transferred to the nearest hospital. And doctor can, while the person is being checked in the rural area, and data is transferred to the hospital system, management system, and there the doctor can see and immediately recommend, yes, there is a murmur, there is a problem, and this child immediately needs some kind of a further investigation. So this kind of technology-driven healthcare to the doorsteps of the people is something that we are looking forward to. And draft is being prepared for submitting it to the health ministry as to how we want to run this healthcare institution. Definitely there are a lot of people who are contributing from around the world. See, they are not selfish. They are not thinking this is India. Why should I help when I'm an American or a Canadian or a European or Australian? They're not thinking like that. They all want to play a part of such a noble initiative. Great investment in humanity, by humanity. And so the idea is that we must do justice to this kind of sacrifice being made by all these people. So we want to take the right kind of candidate, as Mahatma Gandhi Institute of Medical Sciences, Dr. Gangne had come, he told, the key to success of this venture is right candidates. If you pick up wrong candidates, then it's like a wrong seed which is sown. Now pour as much water and fertilizer and care, and you get a wrong tree. So student selection is the key to the success of this. This is what was happening in Mahatma Gandhi Institute. This is what we should do. And we have also data, even scientifically proven, the students selected from the local communities and rural area are 70% chances are there for them to go back to rural area and serve. Whereas if they leave the rural area, get educated in an urban setup, the chances of them returning to rural area is no less than 30%, which we see most of the time. So that is why by the rural, for the rural, of the rural kind of healthcare system. I'm very glad Dr. Sudhakar is quite busy. I know there are a lot of things happening, but despite that, he made time to come and share his very valuable thoughts with all of us. And it reassures us that we have a government that is step in step, that is very visionary, and that is looking at working in these areas which we are so passionate about. And it will be just a matter of time before the medical college comes up. And I'm sure, being the son of the soil, both Narasimha ji and Sudhakar, both are from Chikbalapur only. So they're like next door neighbors, next towns. But both have worked for the betterment of the same district. But let this district not remain, in a way, the working only for the people of the district. Let this district become an ideal district in the whole country. Why not people from all over? Today, Vellore, because of CMC, is famous across the country, in front across the world. Tomorrow, the Sathya Hospital and the medical college here will perhaps become the most important landmark in Chikbalapur. From around the world, people will arrive here and get treated. So that is the vision, and I'm sure it is possible with good hearts, good hands, good heads all coming together, with selflessness in our heart, with divine grace, anything is possible. And therefore, I again appeal to every single person who is associated with these institutions and those who have made it here today to this wonderful conference, including Dr. Sudhakar, who is leading the health sector in Karnataka, that we all should work together and not see ourselves as different groups, but see ourselves as one entity which is working for the single cause of betterment of healthcare services, especially for the underprivileged. May we all succeed. Sarve bhavantu sukhina, sarve santu niramaya should become the order of the day. It should not be, we need not pray anymore, because that is how it will be. When you fall sick only you pray, give me health. When you are never sick, you don't have to pray for health at least. Let our country be such a country which will lead by example. Let our governments, our societies, our institutions work hand in hand to achieve this vision, and let this idea become a reality very soon. With these prayers and with a lot of gratitude to everyone who has made it here and who are watching us live from so many countries, I do not even have a count. All of them are a part of this great healthcare mission. And today we have added a few more members to this wonderful global family through the conference. And I'm sure Dr. Madhusudan is there, who is going to guide us further, Mr. Pratap, and all the others who are here, they will guide us further. in how to take this forward. I thank all of them, and special thanks to Dr. Sudhakar for having come here and shared his valuable inputs. And blessings to all the university staff for organizing this and all the volunteers for supporting it. Thank you.
Extending our gratitude to Sadhguru, we will now come to a close of this valedictory session. We will have a short break for 10 minutes and will reconvene for this evening's cultural program.